Hey guys, Dr. Rich here from Optimal Spine and Joint Center. And today I'm going to take you through one of the devices that we use to help people get people better in our office. This is a laser. It's not a surgical laser, it's called a cold laser, okay? And so what is that? Well, we're going to go over in a few slides what this laser does and how it helps some of our patients. Now this is actually the device we have in our office here, and this is a class 4 laser and it's a 30-watt laser. Okay, so it sounds really fancy and I'm going to explain what it does for you guys. Okay, so there's two different types of lasers out there that are most commonly used in the physical therapy and chiropractic setting. Those are the class 3 lasers and the class 4 lasers. Well, when I was in school, we learned the class 3 laser, and I think most practitioners that are practicing right now have learned mainly on the class 3 lasers. And the class 3 lasers are good and they do a great job, but they do not penetrate the skin all that deeply. And so when you treat with a class 3 laser, you don't get a lot of skin penetration, and in fact, you need a long dosing time. So 1 hour of dose time as a class 3 laser is equivalent to a 30-second dose time of a class 4 laser. Now, when the class 4 lasers first came out, they started with a 5-watt system, and then it went to a 10-watt system, then they went to a 15-watt system, then they went to a 20-watt system, and then they went to a 30-watt system, and of course we have the 30-watt system. Now the class 3B lasers are anything 1 watt or less. Does that matter? Well, it matters for A, penetration, and then B, dosing time. It really is a big thing. I don't want you spending an hour in the room, right? We only want to get you in there for a shorter period of time, and of course we want to get to deeper tissues. Now, when that class 4 laser is penetrating, it's getting many centimeters deep into the tissue. So we have a lot of people that come here with sprains and strains and arthritis in their knees, arthritis in their shoulders, disc problems. And of course, we're trying to get all the way down. And the disc is quite deep. And some of those sprain strains are really, really deep in the tissues. And a class 3B laser is just not going to get there very quickly, okay? It eventually gets there through reactions in the cells, but it takes a long time. We want to get down into those tissues really, really quickly and get that healing started. So, how does a class 3 or 4B laser work? Let me explain. We first shine that laser onto your skin, and that laser has certain wavelengths, and it's going to penetrate different parts of your skin and different parts of your body and affect different parts of your body differently with different wavelengths. And so there's a 670 nanometer wavelength, an 808, and a 904. And I'll give you an example. When we're looking at sprain strain conditions and arthritic conditions, 808 actually tends to be a bit better. However, when we're trying to do like traumatic brain injury or brain injuries, 670 seems to be the wavelength that hits the best. Now the research has also supported this in some of the research studies that have been done on laser. Now that laser gets shined through the skin, it penetrates into our cell, and it hits our mitochondria. And what is the mitochondria? Well, if we can go back to high school biology, you'll remember the mitochondria as the powerhouse of the cell. And what is the powerhouse of the cell? Well, it creates ATP, and ATP is our cellular energy. How does it do that? So the light hits the cell, it stimulates the mitochondria, and inside the mitochondria, this thing called cytochrome C oxidase gets turned on. And it starts to stimulate, and it stimulates ATP, something called ROS, and something called NO. So what are those three things? Well, ATP is adenine triphosphate, and again, that is our cellular energy. That's our first phase of energy, and we need that for our cells to work, okay? And then it turns on ROS, and that's reactive oxygen species. Think of antioxidants. It allows to improve cellular healing, okay? So when those cells get damaged with oxidation from oxygen species that are in your bloodstream, the reactive oxygen species helps heal that area, okay, or heal that problem. And then it's left with nitric oxide. So NO stands for nitric oxide, which increases circulation, decreases inflammation, and helps transport oxygen and immune cells through the bloodstream, okay? So a lot of bodybuilders will take nitric oxide supplements to improve the blood flow to their muscles. We're trying to do the same thing. We're trying to move blood because, of course, when you injure yourself, that blood is stagnant in the area, okay? So what is this thing doing? Well, it's actually causing the cells to turn on. So when people ask me, so what does a class 4 laser do? I said it's like turning the light switch on or turning the engine onto the car. When cells get damaged, they stop moving, and they call it cellular vibration. Those cells aren't vibrating anymore. Hence why if you ever got an injury and you smashed your leg and you get a nice bruise on your skin, it gets black and blue, that's an area of dead cells, right? Those are dead blood cells in the area, and slowly over time your body moves them out. Well, those dead cells, it's like they got hit and they're knocked unconscious. they're not completely dead. Some of them have bust, but some of them in the area are just turned off. They're not working the way they're supposed to. When you hit them with a light beam, it stimulates that mitochondria and turns on cytochrome C. It's like turning them back on, so they get back to healing, and so we can heal faster, okay? But again, healing takes time. It's not instantaneous. So some people, uniquely, feel amazing after one dose of laser. One dose, and they're like, man, that was the thing that's really, really improved me. And other people, it takes 10 or 15 sessions to really get that same effect, because some of those problems are deep, and some of those people are quite old, unfortunately, and their cells are not moving at a very fast rate. Even though we're turning them back on, their healing ability is very, very slow. It's not moving the way it's supposed to, okay? So again, how does all this work? The light goes through our skin, different frequencies of light, hits those cells, turns on the mitochondria. Mitochondria is stimulating ATP, reactive oxygen species, and nitrous oxide to improve our healing ability. Now, one things that it helps with, well, it helps with pain symptoms majority of the time. We got arthritis, pain, disc pain, pain that goes down our arm, or pain goes down our leg, called radiating pain. It can help with headaches. It can help with all sorts of other ailments. However, it can also help with brain injuries. We get people that come here, not too often, but we do get people with stroke, and we do get people with brain-based injuries, even neurodegenerative diseases like Parkinson's and dementia. And you want to help these people as much as possible. And there actually is some pretty cool research out there to show that when you spray the brain down with some laser light, we can actually stimulate the cells in those brain areas that may be injured or not functioning the best, okay? Again, that's not the majority of people that come here. Most people are coming for these pain symptoms, and that's what we specialize in. But if somebody's coming here with something else that maybe is not our major specialty, but we can help them, we're gonna try to help them, all right? So who are we? We're Optimal Spine and Joint Center. I'm Dr. Rich. The website's www.optimalsj.com or www.optimalspinehealth.com. And you can call us directly at 944-88580. That again is 944-88580. And for this month, again, it's halfway through the month of September, we have a special going on. So normally a cost of consultation from myself or Dr. Taryn is 35 Real. However, this month until the end of the month only, and we only have a few spots left, cost of a consultation will be 10 Real versus 35 Real. So again, give us a call or go to our website and book direct on the website, or give us a call at 944-88580. And thank you very much. And if you guys like these videos, feel free to subscribe below or even follow us on Facebook. Please leave comments on the video. And if you have any questions, please comment on the video. If you have any videos that you want to see or any topics that you would like to know about, please let us know. Again, contact us on Facebook or Instagram, or send us a message on OptimalSJ.com, or call us 944-88580. Hope you guys have a good day. Thank you very much.